Welcome to the plenary session of the 29th edition of the SSPH Plus Lugano Summer School. Wednesday night's plenary is on community engagement. And if this is a topic I am so passionate about, I love, and I know that so many of you do too. And I think we have one of the most engaging people to talk to us about this, and certainly somebody who has an incredible amount of experiences in engaging with communities. So I want to present to you Dr. Maria Amalia Pesantes. I call her Amalia, as many of us do. And she received her PhD in medical anthropology and a master's in public health focused on behavioral and community health sciences from the University of Pittsburgh. She also has a master's degree, another master's degree in international development from Clark University. And her research examines health inequalities among vulnerable populations. She studies the challenges faced by Indigenous people challenges faced by Indigenous people to access culturally appropriate healthcare, to have their medical traditions recognized and incorporated into state health services. She also conducts research about the experiences and health needs of underserved populations with chronic conditions. Interested in research that can contribute to designing better strategies to improve healthcare access for people with diabetes and hypertension in low and middle income countries. And I've had the great pleasure to know Amalia for about almost 5 years now. And we've worked on an international project doing just this, community engagement in low and middle income countries. And so with that, I'd like to turn it over to Amalia. I did forget to mention that she is located in Lima, Peru. She's a researcher at CRONICAS in Lima. And she has also just started as an assistant professor at Dickinson College in the United States. So Amalia, I'm going to turn over the mic to you so you can just say an introduction, and then we're going to show you we're going to show everybody a pre-recorded video that you've made, and then we'll open it up for Q&A at the end.
Okay, so now I want to just say hello to everybody, and that I'm very excited about having the opportunity of sharing my experiences here, and I will be ready after my recorded video to answer or discuss any of the issues that I mentioned there, or any other further questions or ideas you have about community engagement. Thank you very much.
So good afternoon, everybody. I am very happy of having been given the opportunity of sharing some of my experience from Peru and other low and middle income countries about community engagement. I would like to begin by saying that I will specifically share with you my experiences and some of my reflections about community engagement in the context of research and in the context of international partnerships for global health. And I would like to start to begin with a story that maybe at the beginning might not seem so obvious about the connection between this story and community engagement and the lessons I learned from a specific experience doing it, but I promise that I will be able to connect the dots at the end of this talk. So around 3 years ago, I was invited to a meeting in Colombia. It was a meeting that was promoted by different UK agencies, and they invited people, researchers from different Latin American countries, with the goal of explaining to us or sharing with us the different funding opportunities they had, and also to explain to us how they have started a new funding scheme where they wanted to partner with local national governments. So it was about new funding schemes where the UK will put part of the money and the other part will be put by the national government. And in the context of this meeting, I happened to be sitting in a table with colleagues from Colombia that I didn't know. And the UK representatives shared with us a funding scheme they have just developed with the Colombian government that was, I think it was related to biodiversity. But one important thing that they mentioned is that they wanted this specific research project that they wanted to fund to happen in communities that have been affected by internal violence in Colombia. And of course, from an outsider perspective, from a non-Colombian, it kind of made sense that, of course, they would like to prioritize communities who have undergone some, traumatic experience, that were underserved, that were marginalized. But the Colombian colleagues who were at the table were a little bit, upset at the fact that when you have to apply for this kind of funds, they will require you to show that you have connections with these communities. Some of them had them, some of them didn't, but in any case, they felt it was kind of not very respectful to just expect them to go to these communities that have a history of being internally displaced, of experienced violence, to ask for letters of support for a possibility of a research project that might or might not be something they were thinking about. And this idea just stayed with me, and it didn't come back to me until later, as I will share with you, when I experienced something similar in relation to working with communities. So to share a little bit about me and where I was coming from, so before being a more active researcher in global health, I actually have worked in NGOs for many years as a development practitioner. And when you do community engagement as part of an NGO project, it's very different. Why? Because the project itself, usually it's something that will have a tangible benefit for the communities. You can do a water and sanitation project where you will not only ensure that infrastructure is built in a community, but you also complement it with maybe health education, in hand washing, or in identifying when diarrhea was something that required to be taken to the health facility. So when you do community engagement in the context of development project or community development, it is very, very straightforward, the connection between, the activities that you're making and the benefit for communities. However, when you engage communities for doing research in global health, and you are not an NGO, but you are an academic institution, the trade-off, the benefit for communities is not always very straightforward. Although, of course, in some funding applications, they require you to write at least a paragraph of how you're going to engage communities. But usually, what happens is when some researchers think about why is it important to engage communities, the answer is kind of obvious in the sense that, okay, if you engage them, they will be able to provide information about the problems that are more important for them, and of course for researchers to address. But if you think only about this answer, that community members will be able to provide information about their health problems, in a way, from my perspective, is a utilitarian perspective. Because you want to engage them in your research project because they are going to provide you relevant information for you. And I think that is something that we should try to avoid, actually. From my perspective, rather, what we should be thinking when we think about community engagement in research in global health, we should be thinking about engaging communities to ensure that the research is relevant for them. And that implies, of course, thinking about community members, participants or subjects, not as passive data sources, that they're going to be giving you information, but as agents that have their own concerns, their own commitments that you will need to respect and to learn about. So, of course, working as a researcher with community requires to adapt to a new situation all the time. Of course, it requires flexibility in terms of the time frame, because sometimes you plan that you will have done, 3 visits to the community, or, focus groups, or whatever method you have chosen to use, that you're going to complete that in, 2 months. And actually, it just happens to be, either the rainy season and you cannot go, or the harvest season where everybody's busy. And you really have to be able to adapt to that situation, Your methods might need to adapt. Maybe something that you thought will be very applicable in that setting is not, and that of course has implications in your budget. And not always the research projects have such flexibility. So I want you to also think that when I'm discussing about community engagement, although I speak from the perspective of a researcher, I'm all the time also thinking about what should funders and funding agencies from the North be also aware of when they, request or they expect our research projects to engage communities. So this is one of the important things that, in my experience, you need to be able to convey to funders, that if you're going to be really striving to working towards engaging communities as part of the research process, you have to have flexibility in terms of the time you're going to invest, how you're going to access the data, and maybe new things that might appear. And of course, changes in the budget, because if you, for example, end up having to go to the community 3 times rather than 1, because it is important for you to be there to participate in certain meetings, then that of course implies changes in the budget. Another change that is important that is not really connected to budget is what I am calling epistemological flexibility, which means that you need to change the way you see yourself, of course, as somebody who knows a lot about how to conduct research or how to approach a particular health problem, and to enable community members to become your research partners. So really, it requires humility. It requires you to engage and to promote and enable horizontal interactions with community members. But of course, this is ideal, no? And I think that something important is also not to, in quotes, lie to ourselves, because we cannot deny that there are power differences, even if you are also somebody from the same country, somebody who looks maybe like the local population, you still have more education, you still come from the city, you still have a different way of communicating. And communities from underserved areas, from marginalized populations, also have probably a history in which their opinions have not been asked in a regular way. So also creating this space of trust and people be feeling confident and comfortable expressing their views is also that takes time, and takes also an investment from both sides in emotional things, because you spend time with the community, maybe they start sharing things that have nothing to do with the project but are part of things that are important for them. For example, in one of the projects I was working, we were discussing, we wanted to know how primary healthcare services were relevant or were appropriate for people with chronic conditions. And we not only focus on diabetes and hypertension that are typical chronic conditions, but also epilepsy, which in that particular area is the result of an infectious disease called neurosis psychosis. However, and when we interviewed some of the patients with epilepsy, I remember one of them shared with us that she had a very, very bad story of domestic violence, and actually her local explanation for having seizures had nothing to do with the neurosis psychosis, but actually it had to do with having been hit really badly systematically by her first husband. So people are opening up to you. They are sharing their stories. So community engagement is not only about the meetings in which people express their opinions about the research, but also about all these other interactions in which you learn more about the challenges of these communities, the context in which they live, and some things are really interesting, and then you are very happy to hear about them. But in other instances, it's also something that is hard to hear, and you as a researcher, of course, know that you cannot solve all the problems, but you are listening to them and you are engaging in these relationships. So I'm going to now focus in one experience that made me think more about what are the implications of community engagement, especially when it maybe doesn't work out the way you wanted it to work. So this was a project that happened under a funding scheme that actually allowed us, when we applied for the funding, to prepare a 6-year project. So that is something that is like gold for researchers, no? The opportunity of having a very long project in which you can really invest time in getting to understand better the communities, the context, and also building a good team, as researchers, because this was a project that happened in different countries. So the funding scheme allowed us to, all the time, to invest in doing formative research and working with the communities. And however, it had a minor, not so minor detail that said that after the first 3 years, we're going to be assessed to see if the funding was going to continue. The goal of the project was to understand better how primary healthcare services were delivered in rural areas for underserved populations, specific with a focus on chronic conditions. Because as you might know, in low and middle income countries, most of the health services are geared or are designed for infectious diseases, infectious conditions that require, acute care or a one-time visit to the facility. And more, because of the epidemiological transition, there are more people who have chronic conditions that require to see the healthcare professionals and visit health facilities more often and need reliability in medications and people who are trained to provide the care they need. So the goal of the project was to understand how primary healthcare services were delivering care for people with chronic conditions to see what improvements could be made. And we wanted that those changes were something that came from the participation and the opinions and the perspectives of the community. So the community engagement activities required, well, at the beginning, during the formative phase, some team members went and spent time in this community, so they got to meet people. There were meetings with local authorities besides the focus groups and the interviews, and then slowly the activities were going back to the communities and presenting them the research results and try to think together what could be done to improve the health services, which population group should we work with, what kind of activities we could do. So we visited these communities in several cases over a 2-year period, because the first year was mostly to do the formative research, and later for the design or the creation of the intervention, we went more often. So what happened? So after the 3 years of the project, when we were assessed by the funding agency, they took the decision of not continuing the funding. And so here is where I think there are two distinctions that we have to make. One thing is that you as a researcher are told that your research project is not going to continue, and that's part of your professional life, that sometimes maybe the things that you do are not so great as you think they are. But then I think we have not anticipated what was the implication of this for the work we have been doing with the communities. Because although you might think, well, it's obvious that you should have told the communities that there was a possibility that the project will not continue, that we will not be able to deliver any intervention, and that we might not be able to, we might need to leave our work at that stage. I think in a way it really doesn't matter how many times you say this, because as somebody who come from outside, who organize meetings where you provide food, people have expectations about the things that you can do for them, about the money you might have access to, or the resources you might have access to. So it doesn't matter really how many times you say that, this is just, a first stage, we don't know if we will be able to come back, we don't know if we will be able to continue. The fact that you go there often, that you share informal conversations, and you have all these meetings, really create expectations, and that I think there is a responsibility from our end as researchers, as people who have had more privileged in life, that have the opportunity of then going there as researchers to do something about what we are observing. And that is something that in a way conflicts me, and that I think it is important to discuss these things, no? About how you engage with communities and how you feel about that relationship that you build, and what are the opportunities and possibilities of really continuing with that relationship. So when this project was not able to continue for the additional 3 years, we were given, 1 additional year to do certain things, but of course it did not include continuing the work with the communities, because that was part of what we wanted to do for the 3 years. So I was the one together with some other team members who had to go to the communities and tell them this, because it was not just about receiving the letter saying that you were no longer going to be funded and then disappearing. We knew we had a responsibility to go back to the communities and tell them. So how did they react? Well, in a way they reacted in a good way. They said, this is not possible. We are going to write a letter to say that what you have been doing here is great. And actually, that was something we didn't expect. And luckily, that meeting happened at the local school, and the teacher was there present in the meeting. So she opened her office, and although it was a Sunday, and she allowed us to use her computer, and we wrote the letter of support from there. And so that was very rewarding for us, because it really meant that they felt that we were a team with them, and that they could support and they could help us make a case for the funding to continue. And they totally understood that it was something that we were not expecting, that we have tried our best for this project to be successful and continue, but that it had not been enough for the funding agency. So in a way, what happened was something not so, there was no conflict or anything like that. But I think for us as a research team, there was a big disappointment, and it was hard to face the communities and tell them and provide this information. And if you want to do research that implies engaging communities, I think we have to be prepared for these situations, and I don't think we get many opportunities to discuss about this, And of course, then our goal was, okay, let's write another grant and let's get more funding to be able to return there and work with them. But it has to do with also thinking about that, in the long term. If we want to re-engage in the future with these communities, how do we go back? How do we present ourselves, and how do we get to trust in us? And also, I think that there's a difference between what local researchers in the South, to put a label, have to do and feel when these things happen, and what our international partners felt, because we have great colleagues in the country from where the funding came from, who were really engaged with us, and we're also, of course, disappointed with what happened. But I think we have to think about the different processes that researchers face when these kind of things happen. And that takes me back to the story at the beginning of this talk, when these funding agencies from the UK and even the Colombian government in this case was requesting, or in a way, demanding that the Colombian researchers make these connections with local communities who have gone political violence in the recent past, to request their support through a letter for applying for funding. And I think that sometimes funding agencies do not realize what are the implications for researchers to do these things, to engage in this kind of requests, even if they have a long-term relationship with the communities. The moment you ask for a letter of support, the moment you go and talk about the possibility of a project, you are creating expectations. And I think that is something that it's not really, I don't think sometimes funding agencies think a lot about that aspect of the work, or of requesting that we invest in community engagement. So what is the take-home message for me from this experience? No, I think that on the one hand, there should be ways in which these kind of experiences can go back, like as a feedback for funders. They so that they are aware not only that there's the flexibility I talked at the beginning, and that maybe there are maybe more funds, or that that there might be changes in the original research plan, but also to think about what are the kind of partnerships we want to build with communities. What are the kind of partnerships we want to enable to occur between northern researchers and southern researchers? And I think that all these more the emotional cost of engaging with communities and then having the project not work out, or taking longer, or taking less, I think those kind of things are not really taken into consideration. And I do think that there should be ways in which these experiences get to be shared with funding agencies, and we start to think about how can we reframe community engagement in a way that we anticipate these kind of things, because it is also about what I talked at the beginning, that maybe research projects do not have any immediate impact in the communities. We are going to have results, and going to have an intervention that might not benefit directly this community, but maybe other communities. Maybe you want to promote a policy change based on the results of your research. And these ideas about what is research, how do research results are then taken or uptaken by different organizations or national institutions, is something that they are not always conveyed to communities. No? And also my other take-home message as a researcher is that I think we also need to be able to think about how to better explain how the research process works, how funding works. And I think we should try to figure out ways in which we could commit to providing some kind of benefit to the communities beyond participating in the research. No, I don't have an answer right now, but I think that should be something that is transparent with the funding agency, and that you also have an opportunity to discuss with communities that even if maybe the research doesn't happen, even if this is just a pilot project, there is some minor amount of the budget or of your time that you are going to invest in supporting something that is important for the communities. So that is why I wanted to share with you today, and I'm hoping that you will have lots of questions for me, and that I can continue sharing some of my ideas, or that you can also share your experiences and your ideas about community engagement in the context of global health research. Thank you very much. This is my email.
Thank you very much, Amalia. Wow, such an incredible, I guess, food for thought is what I'm going to say. Thank you. I wanted to just invite everybody who's listening to this to ask your questions in the Q&A feature in Zoom. At the bottom of your screen, you see Q&A. If you can just type your questions there, then we will read them to Amalia and she can respond to those. And as we wait for those to come in, I have two questions for you, Amalia. The first one is related to this project that you haven't named, but that you talk about that was canceled. And I know it quite intimately as well. And I remember it being in one community with you. We can go ahead and say it, in Nepal. And I remember being at a community meeting where we were very much welcomed. And it was a beautiful situation. The community was there, the doctors came to visit us, the mayor was there, the community members greeted us. And so there was a lot of warmth and acceptance, but there was also skepticism. And I remember very vividly one person standing up and said, "We've seen you people come here before and you leave." And he was very honest and real. And we were convinced at the time that we wouldn't be leaving. And yet we had to leave because the extra 3 years wasn't granted to us. From your perspective, how can we manage that better? Or how could funders manage that better? Because I see a lot of harm in those kinds of situations where you do, as you were talking about, we create expectations and we ensure trust and then we can't deliver.
Yes, so I think, and I think the important thing is that we should be aware that that is a possibility, and I don't think we think a lot. Like when you work in development projects, you are thinking about that quite a lot, no? But I think when we do research, sometimes you get stuck in thinking about, you know, enrolling participants and ensuring that you do all the service part. I have a echo. Is that okay?
It's okay.
Okay. And so I think the way of doing this, I think it should be to find ways in which when the funding agents, when you are applying for funding and the funding agencies are encouraging you to do community research, you request or you negotiate or you upfront say, you know, we would like to set aside some part of our time or some money to do something that is meaningful for the communities, this regardless of the research. You know? So I think that will be a possibility, but I am also open to suggestions because I also feel that I don't have the answers, but maybe that would be something that could be discussed, and it has to be, of course, discussed as a research team, because I know that some researchers are more cautious about these, you know, about not contaminating the research. But I think the moment that you engage communities, there is a different dynamic that starts, that is very organic, and you have to be able to ensure that that is something that it's not harmful for them. And one way would be to have something prepared separately for doing with the community, even after the research project, if you don't want it to be contaminated, or, you know, at another moment or with another group of the community, depending on the kind of project you have. So that's one of my ideas. Thanks.
Thank you very much. My second question for you is that how have community engagement methods changed, if at all, since the novel coronavirus has come to our world?
So actually, this is something that I shared in the course that I just taught with Nadina about one experience that is happening right now in Peru. So for example, when you have managed to build really good connections with communities in the context of the pandemic, for example, some of us work with indigenous communities in the Peruvian Amazon, and what has happened is that they have contacted us because we used the relationship we already had and the network we already had in place with these indigenous communities, and to ensure that we have an opportunity to hear what was happening there. So a group of researchers, I was not part of that group, but I have friends who are part of that. What they did was they built a platform in Facebook, and they asked all their community partners to make videos to express what was happening in their communities in the context of COVID. So they will say things on the one hand about, you know, we don't have any help, the health facility doesn't have any medications, or the doctor just disappeared after the pandemic started, but also to share the things that they are doing. You know, we are not allowing anybody in our territory, so we are protecting ourselves like this. If somebody comes to our communities that is not part of us, like even tourists were going to these places, we have a special house for them, so they stay for 15 days. So what happened is that the community engagement has come from the communities to tap on their friends who are researchers, and this has enabled the researchers to use not only their networks, but their abilities to, for example, post these things online or write blogs and make visible the specific ways in which indigenous communities are being affected by the pandemic, and how some of the policies in Peru, for example, that have been promoted by the government are really not appropriate there, such as, for example, giving cash to, so it was a very urban approach of giving cash to poor families to compensate for the economic hardship that the pandemic will bring. But what created in the case of indigenous communities where there's no bank is that they had to go to the town to cash their money, and that was a vector of infection. So all the people who went to the bank to cash the money because of this brilliant policy from the government actually became infected and brought the virus back to the communities where there were no cases before. So it has enabled us as researchers to showcase the specific characteristics and the specific things that are happening in the communities, and then some big newspapers or journals have requested some researchers to talk more about these things. So that is how community engagement I see is happening, of using the networks that are created, that are already exist with researchers to promote, to make visible some of the particularities of what is happening in these places. Thanks.
So, Dr. Pesantes, we have a question from Klazine van der Horst, and that writes, to follow up on Professor Sachs' question, how can we create the expectation and behavior in the community that they take ownership from the beginning of the projects? Then it does not matter that the research team leaves.
I think the question has the answer in there already. So I think that, each research project is different. So in this particular project that I was talking about, it was something that was initiated by us as researchers, that we were there, and we went there, we contacted them because we were interested in documenting the experiences with this particular kind of disease called neurocystic sarcosis. So it was a community we didn't work with before, and we were the ones who initiated the project. So in a way that put more weight into what we wanted to do, and the engagement with the community happened more in the moment where we were thinking about solutions. But I think, as the question itself says, it would be different. I think it's different when the community itself is the one who maybe initiates or have already been thinking about how to address a particular health problem. And maybe you are called as a researcher more to facilitate how to go about this. So I think that in those cases where it's the community who is using their own agency and their own ideas to then tap on resources and skills to change things, changing with them, is that when this risk of affecting them and if the project doesn't continue is minimized. So I think that the answer is in the question, in the sense that if you manage to, if it's a project where the communities have been more active since the beginning and they have been the one prompting the solution, and there are cases where this thing happens, then of course the risk of disappointment or of things not happening, which is the major concern, that nothing happens after you leave, it's not so strong. Another thing that I'm thinking right now is that if you anticipate that this is something that could happen, in our case, for example, we're thinking that maybe we could have built stronger relationship with the local health authorities. We have good relationship with the health workers, but they were not enough to change things. So if you tap on the local health authorities so that they are also involved in what is happening and your research project, then even if you don't, especially in middle income countries when there's still some money in the government, then maybe even if you leave as a researcher, you already have established the connection between the needs of the communities and the responsibility of regional health authorities to do something about a problem. So that is another thing, that you engage other stakeholders that could have some power to make things happen, even if the specific research project doesn't happen.
Thank you, Dr. Pesantes. We have another question from Lena Spies. Assuming this scenario for a new project and you want to implement a new policy on national level to reduce stigmatization of health workers caused due to COVID-19, beside the implementation on policy level, you actively want to engage the community with, for instance, an awareness campaign. Who could be the key driver in the community and who needs to get involved?
Let me also read it because it's like a long question. In awareness campaigns. could be the key driver in the community. Okay, so I am understanding what the question is about, is that now healthcare workers who have been exposed to COVID facing a stigma because they might be, infected, and they might bring the viruses to communities. So who should be involved? So first of all, I think we should, in any community, there are always different opinions, and you should first identify who will support. There are different views about the possibility of healthcare providers being the ones who bring the virus, or who are actually sacrificing their own health to help others. So I think it will be important to first identify who perceives healthcare workers as those who are sacrificing their own health to help others. And then it will be important to work with them and identify what are the sources of fears of those who actually are stigmatizing healthcare workers. And I think those will be the two elements that you will need to work around to do a campaign. And for me, who should be leading this campaign? Yes, it could come from the community, but I think in this specific case, if healthcare providers are public servants, that they are paid by the government, I think the government should also step in facilitating the resources for the communities to do this campaign. Because this is something, you also have to think that who has the responsibility of destigmatizing healthcare professionals in the context of COVID? I think the government has a responsibility. And so I think that will be something that in this particular case would need communities to work together with governments to address this stigma. Thanks.
Thank you. We have another question from Virginie Masterey-Spicher. What kind of requests or expectations from the community did you encounter that you were not prepared or surprised to hear? Were you always capable of integrating this in your research project, or do you think it is always possible to do so?
Okay, so in order to answer this question, I'm going to use examples from other community experiences. So one of them was, we had a project. I just shared this example in another space. So we have just finished a project to understand what were the challenges of indigenous people to access tuberculosis diagnosis and tuberculosis treatment if they were diagnosed with tuberculosis. And we identified several of the barriers, and then we organized a meeting with indigenous leaders where we presented the results. And when we presented the results, some of them were very thankful, and they also said that another concern they had was about sexually transmitted diseases and HIV in indigenous communities. So we kind of captured this idea, and when there was a grant opportunity to do a development project, not a research project, we thought in that same region, we decided to write an application for promoting, for improving access to reproductive health services and to prevent HIV transmission. But what happened is that these indigenous leaders who had been present in this meeting were leaders that were from like a regional level, and these communities where we ended up doing the project were not concerned at all about HIV. No? So in this case, they were really not interested in the project we were bringing. And what happened there is that luckily the communities themselves gave us a solution. So they said, okay, we, like the adults of the community, were not really concerned about HIV. There are no cases here. But you know what? We have a problem because we feel uncomfortable talking about sexual education with our children, and they are the ones, the adolescents are the ones who during their holidays, they go to the cities or to the towns, and some of them work, as waitress in bars, and they are exposed to engaging in sexual intercourse with other people, no? So they gave us a solution of working with another part of the population. So that is one thing that can happen, that when you go to the community and what you want to do is not exactly what they want, maybe they have also the solution of working with another group. And if there's flexibility in the funding agency, then you can also, change the target group, and in some cases even change the topic, of research. In this case, it was good because although it was HIV, we changed it to sexually transmitted diseases, so it was okay, but it's not always the case. There was another part of the question, but I cannot see it anymore, but I hope I helped with my answer.
Thank you, Dr. Pesantes. We have another question from Mike Upio. it seems that communities are more receptive to research from NGOs and development agencies than academic researchers for policymaking. This is because of their interest. What is the best strategy to engage communities in this situation, mainly in low and middle income countries where aid agencies are more prevalent? How do academic researchers can adapt to succeed in this situation? Thank you.
Thank you. Okay, so here is when there's an important distinction between low-income countries and middle-income countries. And I speak from the experience of having been working in Peru while it was a low-income country, and now that it's a middle-income country. Why? Because in middle-income country, what is happening is that the aid agencies no longer support active projects at the community level, so they don't no longer fund water and sanitation projects or health education projects, but rather what they have realized is that in middle-income countries, the problem is not about the government or public funds, it's about people not of how to use those funds. So for example, in the case of a middle-income country, what researchers should do is to ensure all the time that you engage with policymakers, with people at the government, and the key people at the government, and you should not build those relationships, from my perspective, only for one specific project, but you should try to, like, for example, I work in a research center that focuses on chronic conditions, diabetes and hypertension, and mental health. So we have established, so the policymakers, they know who we are, they know the research we do, and so there's a fluent relationship with them. They can call us, they invite us to give talks, or sometimes they want information that we don't have. But the idea is that one strategy is that researchers should establish this relationship with the local health authorities, with the national health authorities, so that when it comes to promoting change, you don't depend in the aid agencies, but you actually depend on supporting the government in allocating the funds in a way. Of course, the challenge there is that we as researchers are not trained to convince policymakers of things, so that is some skill that you need to add to your team, and that was something that happened in the previous project I was talking about, where we had people who had more experience with communication, so that is important. No? In low-income countries, maybe that it will be different because there is more, aid agencies invest more in direct projects, and then I think the negotiation would have to be different, no, for researchers in those settings. But I think the important part is to think ahead. What are the things that could happen, and how can I minimize the harm in these settings? Thank you.
Thank you for your reply. Let's move to the next question. What would you advise as the best strategy for managing differential power when engaging with communities?
I think the first thing is to be two things. First, to be honest about yourself. Ourselves. Sometimes we think that because we are very friendly, or because we can talk a lot, you dilute the power relations. And I think you have to be aware that that's not the case. That will always be there. And what you want to do is to acknowledge that is going to be there, and despite that, try to create an environment where people feel comfortable expressing their views. No? And also, so I think that the important thing is not pretend that is not there, but actually acknowledge it and work through it. No? And recognize that you have possibilities, and you represent you represent a group of citizens from the same country that have some privilege. Another thing that I think is key, and sorry, Suzanne, because we were together in Nepal, but it's also important to think, what does it mean to bring somebody from outside to a community, somebody who is really wide looking or really foreign looking, because that of course is somebody who is very different to usually who goes there, and they are, and of course that they represent people with money, people who are with resources, even more than the local researchers. So you have to be, when you bring your colleagues from abroad to these communities, you have to do it in the right moment and do it in the right setting. So I'm not saying not to do it, you have to do it, because it is important that we all know the groups that we are working with, and that they, of course, the communities know us, no? But I think you have to be very strategic about when you bring your foreign partners to the communities, and also generate a space where people feel very comfortable and know that they have to, be very formal, no? So those are two things that I think could be done to manage the differential power with communities. Thank you.
Thank you, Dr. Pesantes. Let's move to the next contribution by German Guerra. Thank you for your presentation and sharing your experiences. I believe there is an ethical imperative in community engagement for research to avoid subjectivity expropriation of research participants. For researchers, it's pretty clear that they will obtain a benefit from obtaining data from subjects in these types of projects in the form of a publication or personal CV engrossment. But it is much less clear for them how to really return and value-added knowledge to the community that has been researched. So from your experience as a global health researcher, could you provide an example where you identify a value-added return to the community as tangible as the returns you experienced in your career as an NGO activist?
Thanks for your question. I think it's something really important that we not always think about. Like for example, one example is what is happening right now with COVID situation. So when I did my PhD research, I worked with these nurse technicians that are indigenous, that were trained in using traditional indigenous medicine and biomedicine. And my PhD research was going to the health facilities where they worked and see how they were combining this medication, these two medical approaches. And so I spent time with them, and we became friends. And over the years, it was 10 years ago, over the years we will get on and off, we will learn about each other, maybe through Facebook and it just happened that at the end of February of this year, through an opportunity that came from the University of Zurich. It's a long story, but it came through the University of Zurich. I was able to go back to this place and reconnected with 18 of these nurse technicians. And we had a workshop where we reflected about their experiences over these 10 years, providing care, combining these two medical traditions. And I was supposed to actually go back there to do research with them in April and May. It didn't happen. But we reconnected. And when this pandemic started, it was just obvious to call them and say, okay, how are you doing? Do you have cases in your communities? What is happening? And they were telling me, how they didn't have the protective equipment, how they didn't, so they didn't have a lot of information about how to manage the patients. And it was for me like an opportunity to help out. So I actually organized a fundraising campaign with another colleague from Switzerland, and I wrote to all my Swiss friends, and now you can be my Swiss friend too. And I asked them, this is happening. I know these people, I know they need this support. And actually in the process of raising the money, one of them, because several of them got COVID, but one of them actually ended up dying. Somebody that was with me in February. So I think that was an opportunity of doing something for a group of people who at some moment were just research participants, but then in this moment, it was something that I could do for them. And now we are trying to combine also this help that I gave with also research, because we also want to know how they are using traditional medicine to address COVID, because there are some medicinal plants that are good for respiratory problems and respiratory infections, and they are using them, and some of them are very successful. So I think that was a very recent opportunity where I had the chance to return something tangible. But it's not always like that. And maybe in this context, I wish it hadn't been like that. But that is something that happened, for example.
Okay, thank you, Dr. Pesantes. We still have time for an additional question from Precious. How do you deal with failed projects in terms of community engagement? How do you regain trust?
Ooh, okay. So I think one way of doing it is that, so there are two things. Sometimes in research projects, there are many different faces coming to the community. So you have one team who goes to collect the data, then you have some other team who go to facilitate the meeting. So one important thing is if you have always at least one face that is common throughout the project. And And that is, that's something that's, and even after the project, if you have really built good relationship, they will still call you, or you will learn about something that is happening in the community. So I think if possible, and there are more opportunities to social media like Facebook to maintain the relationship with them, because if you really believe as a researcher or as a field worker that the relationship you have with them is not only about the information they can provide to you, it's about also, relationship that you can build, a different type of friendship, if you want to call it like that. It will be something that will continue over time. So one way of being able to regain trust is not losing the connection, no? And whenever and telling them, for example, you have them in your mind also. So when there's another opportunity, either for a research project or an applied project, you call them up and say, there's this opportunity, would you like me to help you apply, or things like that. So one way is to never lose the connection with people as much as possible. And it is not easy, but it is possible nowadays. Even just to, when they put that it's their birthday on Facebook, just, saying hello. So that is one thing that you can do. But otherwise, if you lose connection with them, I will think that regaining trust, like in any kind of human relationship, will be hard. And maybe the next time you'll have to have more certainties about the things that we're going to do and how it will be beneficial for them. Thank you.
Thank you very much, Amalia. I wanted to close the session with a couple of comments, and two are written in the chat. Many people can see them, and I think that they're worth just saying out loud for the world to see. Thanks, Doctor, for your answer and your passion for community engagement. You are amazing, Professor Pesantes. Very interesting lecture, and thank you for the presentation. I think this just reflects how important it is to engage with communities, and a community of public health like we are here today, with people coming from over 37 countries. Thank you very much for this inspiring talk, enlightening talk, and a really important talk. A message that I take from that, and I hope that everybody took this, and if you don't, I'm going to stress it right now, so take this: never lose the connection, and never lose the drive. Regardless of where the funding goes, never lose the connection and never lose the drive. Communities are worth it. Thank you very much. Thank you for this excellent talk.
Thank you, everybody.
The comments keep coming in the chat saying, thank you, we appreciate this, and we really do. We feel it, and we give you a big virtual hug to everybody out there. Keep on keeping on. Thank you. Bye-bye.
Thank you. Bye-bye.